Okay, hey everybody, let's get started. Forgive me for a second here. I've got some technical difficulties, so let me get this slideshow started. Now, the way this works out is let me just make sure my microphone's on. Good. The way this works out is I'm unable to answer your questions as this goes along, because the way my screen works, when I go to this screen that you can see right now, I can no longer see anything else. So I can't see your questions. I can't see comments. So by the nature of this thing, though, we typically will answer most of your questions just as the presentation goes on. My purpose here tonight is, number one, I don't want to take up too much of your precious time. I know that I've only got your attention for about 32 minutes, and so I'm going to try to keep it as brief as I possibly can, so that I can share with you the information about regenerative medicine, what we're doing with it, how it may be able to apply to you, and also there's some really cool stuff in here. So there's some new stuff that I'm super excited about. So I got to get through that information. If there's time left over in the end, I'll hang out for a little bit if you want to ask any more questions. But rest assured, we're going to get into where the stem cells come from. We're going to talk about cost. We're going to talk about all those questions that you have. We're going to answer them here in the next 30 minutes. So, look, we talk about, well, let me get ahead of myself, or let me get caught up with myself here. Because of the whole time constraint, I don't get into the details about the stories. I don't show you the video testimonials. Those are all on my YouTube page. They're all on my Facebook page. You can find them there. I do lace a couple of stories in here, though. Especially, I'd be at a loss here if I didn't talk about this guy for a second, because that's my dad. And I'll tell you, my dad was scheduled for bilateral, that means both knees. 2 years ago, he was scheduled to have both of his knees replaced, and we injected him about a year and a half ago, and he still continues to do really, really well with this. So it's lasted him for a long time. He's much more mobile. I just got back from camping with him for a week. And it always amazes me that how well he's moving, how fast he's moving. You talk about these people that are concerned about going into a group home, about having these knee replacements done and the side effects from surgery. All of this stuff applied to Dad, and we just didn't want him to lose his independence. And so he proceeded forward. We did the injections. He's doing great today. And I'm always telling stories about him, but this is the first patient we injected. It was awesome. It's been a great experience for him, but I just wanted to share that. I do have this quick video of him. This is actually 5 weeks after his injection, and he's out pushing a big gear on his bike. So I was pretty proud of that. And then this is, I think, 3 weeks ago, I caught him doing this in his front yard, just pushing a wheelbarrow across the yard. So for a guy that needed 2 knee replacements that had bone-on-bone knees, I think that's pretty dang good, and I would be at a loss if I didn't share that with you. There's other videos that I put in here that I'm not going to share just because of time. So again, I invite you to please go to the website, go to the YouTube page, go to our Facebook page. They're all there. We share them frequently. So go check those out, and you can take the time to do that later. So a couple of points to consider. When you signed up for this webinar, the first thing that the email that you got, there was a place where you could actually download this ebook that you see on the right half of your screen. This ebook contains all the information that we're going to talk about tonight. It contains links to videos that further explain what we're doing. I hope you've been to our website. Our website, I think, is great at answering all those questions. Everything is on there. So everything we talk about tonight, it's already published in the ebook. You can go back and reference that. You can go to our website. Everything's on there. Again, I've talked about Facebook. I've talked about YouTube. I hope you follow me on those areas, because I do publish a lot of stuff on there. Third point to consider, and I think most of you already know this, but the FDA has cleared stem cell therapy the way we're doing it, but they have not approved it. That means that because the FDA has cleared it, that means it's legal to do in this country as long as you follow specific steps that we'll talk about on how to be safe. But they haven't approved it as far as an approved therapy for treating, conditions X, Y, Z. And because of that lack of approval, there is no insurance coverage, no Medicare coverage, no Medicaid coverage. But I'm very, very forward about pricing, so you know exactly what you're getting into before you get into it. Now, Someone asked me the other day to specify a little bit more about the FDA and their stance. I'm not going to get into that in this particular webinar, but I will be making some more videos later this week. So we use cells that come from donated umbilical cords because we feel these are the safest and the most effective stem cells that are available. That's not just my feelings. That's a whole lot of other people with research to back us up to say that these are much more effective than using your own stem cells. But I just want to make sure that that point is clear, that we are not using embryonic stem cells. This has nothing to do with dead babies with aborted fetal tissue. None of that applies. That's illegal. That's immoral. You cannot do that in the United States. I would not do that just because it doesn't resonate with my moral compass. So these cells are very much donated by healthy moms, healthy babies. They come from tissue that if mom would not have donated it, otherwise would have just been thrown away. So that's where our stem cells come from that we talk about. Lastly, the purpose of these webinars is, number one, to inform you. Number two, if what I say resonates with you, I'm going to ask you to set up a consultation so that you and I can talk about one-on-one about what your options are and what direction you need to go from here. So I hate sales. This isn't a sales thing. This is about science. But there is a button on your screen that says, click here for your consultation. Don't do that yet until you hear what I have to say, because there is a hook. There is an offer at the end. So just hang with me, okay? And that's what I'm going to ask you to do when I'm done, is to set up that consultation. And if you're not in Idaho Falls, if you're in our surrounding areas, we can do that consultation over the telephone. So those are the points that I want to consider. Next thing I want to talk about is, what is regenerative medicine? What is that definition? And if you go to Wikipedia, the definition is a branch of transitional research in tissue engineering and molecular biology, which deals with the process for replacing, engineering, or regenerating human cells, tissues, or organs to restore or establish normal function. It was not too long ago that they made a heart out of stem cells. Now, are we ready to start doing heart transplant from stem cell therapy? Absolutely not, but we're well on our way. And this whole branch of translational, that word translational, I mean taking one cell type, turning it into another. My opinion is that regenerative medicine, stem cell therapy, is the future of medicine. This is the direction that we're going. But I want to make sure we're clear about what our definition is, and here it is. It's the use of human cell and tissue product for the best chance at avoiding invasive surgical joint replacement. There's going to be some other conditions that we talk about when we start talking about intravenous applications and this big fancy word called exosomes, because that's the direction that's where we're going. But this is our definition for right now. It's the use of human cell and tissue product for the best chance of avoiding invasive surgical joint replacement. So, what is human cell and tissue product? They are platelet-rich plasma, stem cell therapy, and that should say exosomes, but self-care definitely applies. I just haven't made that change yet. So let's start off by talking about platelet-rich plasma, or PRP. So on the left of your screen, that is actually Amanda's hand, and if you've called my office, you've talked to Amanda. She's kind of the glue that holds us all together. But Amanda is also our phlebotomist. So what will happen with our joint injections and with PRP, what we'll do is we'll start off by taking a vial of your own blood. So Amanda will draw the blood, and then she's going to put it in this on your right. This is our actual, this is our centrifuge that we have in the other room. And what will happen is she will centrifuge that blood. She's going to spin it down. And if you see right here in the middle of that vial, you see that white substance? That's like a wax that acts as a filter, so that all of the solid material, the red blood cells, white blood cells, everything else is pushed to the bottom of the tube. That leaves us with that yellow substance, which is platelet-rich plasma. And we can use PRP as a standalone, and there's a mountain of research behind this. We can use this for regenerative medicine purposes. We can use this to help you to grow new cartilage and get relief. What we find is that using PRP is a little bit quicker method to help someone get some relief, but it doesn't last as long because it may contain the things that you need to build the cartilage, but it lacks the stem cells that are needed to actually regenerate new tissues. So PRP, we do it all the time here in this office. It is a viable option. It is a cheaper option, especially if someone's younger. They may respond to this better, but it usually does take 2 or 3 injections to really get the full effect, unless you use it with stem cells. But PRP, that's what it is. It's platelet-rich plasma. That's using your own blood plasma to inject into the joint to help start regenerating and regrowing new tissue to get some relief. So that's PRP. Next is what is a stem cell? Okay? A stem cell, the best definition I've ever been given was actually by a patient of mine. And he told me that stem cells are like blank slate cells, and it just made absolute sense to me. So right now, hanging out inside of your bone marrow, inside of your blood vessels, inside of your fat tissue, you have a store of these stem cells, or these blank slate cells. These cells are sitting there waiting for your body to be injured to respond to that injury to help to regenerate to help you recover from that injury, to help your body heal, to help create new tissue so that your body can heal. I love this article, Stem Cell Paracrine Actions and Tissue Regeneration. Paracrine actions, that's a very, very important word that we're going to talk about shortly. That just basically means one cell influencing another cell to activate, to do its job, etc. Paracrine actions are very, very important when we start talking about exosomes. But for our purposes, this is great. Stem cells have emerged as a key element of regenerative medicine therapies due to their inherent ability to differentiate into a variety of cell phenotypes, thereby providing numerous potential cell therapies to treat an array of degenerative diseases and traumatic injuries. Okay, so in English, this basically means that stem cells are used to treat a wide variety of stuff because of all of their possibilities. And this slide, I think this slide describes it absolutely perfectly. Up here, up here at the top, you have the mesenchymal stem cells, or in other words, blank slate cells. Again, they're hanging out inside of your bone marrow, blood vessels, and fat tissue. They're waiting to be released. So when you get injured in, say, your muscle, those cells are released to go to that site of your injury and start becoming the injured tissue. So they become muscle tissue in that instance. They become tendon in this issue. They become adipose in this issue, and so on and so forth. Here's a really important one. They can become cartilage. Mesenchymal stem cells will go to the site of the injury and become the tissue that's been injured. And there's nothing in medicine that we know about to this point that has the ability to do that. And I think that's exciting to me. That's what gets me going, is just the possibilities that we have here. So one thing we do have to consider is, as we age, our reserves of stem cells get zapped up. They get used up. So when you're born, about 1 out of every 10,000 cells that you have is a stem cell. So if you think about it, why would that tiny baby need so many stem cells? And the answer is, well, they've got to grow really fast to survive. But as we age, the number drops off drastically. So you get all the way over here to age 80, and you probably can't see that because I think that's where my video is. But at age 80, only 1 out of every 2 million cells that you have is an actual stem cell. So our ability to regenerate and regrow decreases as we age. And if you think about it, if you look at this like a timeline, if you get injured somewhere on this timeline, then you're going to use up those stores, and then you're going to age much quicker. And I know you know of someone you're thinking of right now that got injured, went through something stressful, and all of a sudden they started to get sick really, really fast and age really fast. This was actually my dad. He was in a car accident in the late 90s. And after that car accident, things just kind of went downhill for him. And the reason why is because after that car accident, so many of his stem cells were used up and getting tied up trying to heal from that other things kind of fell by the wayside. The other issue at play is, as we age, our aged stem cells don't replicate as fast. Therefore, they don't. They're not as viable as in the use of therapies. We'll talk about that here in a minute. But it's important to know that as we age, our stem cells age with us. So I jokingly say this, but the more gray hair you get, for example, the less likely your stem cells are to be effective for your own treatment. So we'll talk about that. Not all stem cell therapy is created equal. A lot of people want to know about this autologous stem cell thing versus allogenic. Autologous means your own stem cells. That's taking your stem cells out of you, harvesting those stem cells, putting them back into you, which has been around a long time, but it's just not as effective as taking these stem cells. Brand new stem cells from a donated umbilical cord can be much, much more powerful. But I'm still a big proponent of doing autologous stem cells. People will call me and say, well, I feel like using autologous is a better way to go, and I wish them the best of luck. Even though they're going to spend more money and it's not going to be as effective as using them from a donor, it's still, in my opinion, better than medicine because it's still going to help you regrow new tissue, just not as quickly, not as efficiently. So allogenic stem cells coming from a donor, the most potent ones you have are actually in the umbilical cord itself. So this is where we focus. Again, not all stem cell therapies are created equal. And I put this slide in here because I hate it when people get on my Facebook page and say something like, well, my mother-in-law tried stem cell therapy and it didn't work. Well, stem cell therapy isn't all the same. It's like, the plastic flying discs, we call them Frisbees, but not all of them are made by Frisbee. Stem cell therapy has become a kind of that same way where any type of cell therapy used can be called stem cell therapy. I disagree with that stance. Allogenic stem cell therapy coming from an umbilical cord supported by PRP, in my opinion, is the way to go. And that's kind of where we're headed. So let's talk about stem cell therapy when it comes to osteoarthritic applications. So for you folks with degenerative disorders in your backs, necks, shoulders, hips, hands, elbows, knees, did I miss any? Those osteoarthritic joints, especially those bone-on-bone joints, this is where you need to listen up because this is how it applies. So think of it this way. This is a 54-year-old male that walks into his doctor's office, into one of my colleagues' offices actually, and says, my knee hurts, let's take an x-ray. And lo and behold, the space between the top part of his knee and the bottom part of his knee was 2.8 millimeters. That is otherwise known as a bone-on-bone knee. Okay? So his options at this point are what? Well, if he stays the medical route, he's going to be given some anti-inflammatories, which is good. Getting rid of inflammation is always a good thing because it helps. And then when those anti-inflammatories start working, he's given something stronger or he's given more of them. And when those stop working, that's when steroid injections are recommended. When the steroid injections are recommended, after they stop working, then we go to joint replacement surgery. In other words, you drug it, you can't drug it anymore, and then you replace the part. That was this guy's options for helping with this particular knee. And keep in mind, he was only 54. Hey, well, he goes into my colleague's office, they take this x-ray and say, all right, what if we do something a little different here? What if we come in and we inject into this part of the joint? And keep in mind here, these are nurse practitioners that do these injections. If you've studied my stuff at all, if you've looked at my things at all, you know that I'm a licensed chiropractor. I do not practice chiropractic anymore. The only reason why I've kept my license is so I can order x-rays. But it is our nurse practitioners, it is our medical staff that does these injections. So the nurse practitioner will come in and inject the PRP and the stem cells into this joint. Now keep in mind, when you do a cc of stem cells, when you do 1 cc, it contains about 1.1 million of these stem cells. And when you get them from a newborn, from an umbilical cord, a newborn umbilical cord, those cells are going to replicate every 28 hours. So that number of cells doubles every 28 hours versus if you're 65, they only double every 60 hours. So there's a big replication difference. So this guy gets that injection. And for most people, what will happen is after the injection, they actually feel like the joint's hot, like it's swollen, like it's inflamed, because we just introduced a whole bunch of new fluid in there, and it can be painful for a day or two. Right? But then typical results are going to be somewhere 6 to 8 weeks out, but we're seeing it a little bit quicker when we include PRP. But for this individual, he comes back 4 weeks later, gets another x-ray, and lo and behold, that space went from 2.8 to 5.3 millimeters. And the reason for that is because, sorry, I'm parched tonight. I have to keep drinking my water. The reason for that is these cells continue to replicate and continue to recreate and to grow new tissue to actually add more cushion between those joints. So that's after 4 weeks. 8 weeks after the injection, that number's gone all the way from 2.8 millimeters to 6.1 millimeters. This is what it looks like in that osteoarthritic joint. Hey, At the day of injection, 2.8 millimeters. 4 weeks later, 5.3. 4 weeks after that, so 8 weeks post-injection, 6.1 millimeters. So I ask people when we do these seminars live, I say, what is the difference between this joint and this joint? And most people will say pain, and they're not wrong. But the real difference is mobility. This joint is much more able to move than this joint. And giving someone their mobility is like handing them freedom. It's an amazing thing. And when you talk about mobility, I'm going to bring up my dad again. I was at his house not too long ago, and he was working on a utility trailer that he has. I was trying to kind of help him out and didn't really think a whole lot of it. I went into the house, and he comes in, and he had been laying on the ground fiddling with something. I don't even know what he was doing. And he comes out and he says, "Did you notice something?" I said, "No." He says, "Did you notice how fast I got off the ground?" At 74 years old, the guy's getting off the ground almost like he's doing a burpee. It's mobility is what matters, because moving joints are happy joints. And you got to get out of pain. I understand that. But it's mobility in the long run to keep those joints moving is, you talk about Sudoku saving your brain, like doing those crossword puzzles and things. What's actually going to save your brain is joints that actually move, because those joints are in a constant process of telling your brain where they are in space. And if you can't move the joint, you're not going to get that input. I'm off track, but you see my point. It's mobility that has been the biggest thing. So this is what it looks like on plain film. This is what it looks like in a study, intra-articular injection of mesenchymal stem cells for the treatment of osteoarthritis and the proof of concept trial. The size of the cartilage defect decreased while the volume of cartilage increased. So when your doctor says that there's nothing out there that can help you regrow and regenerate new cartilage, he's right. There's nothing in the medical world, in the pharmaceutical world, that can do that. But here's a proof of concept that stem cells actually can. This is Bridget. I won't show you Bridget's video just for the sake of time. Go look for her on my YouTube page. Her story is pretty awesome. Her brother got knee replacement. She didn't want to go there. She got injected, didn't miss a day of work, actually fell on her knee, thought she re-injured it and undid everything we did, but that healed too. So it's a pretty remarkable story. Go watch it. It's awesome. I love this testimonial. Bridget did a fantastic job for us. And if you want to go visit her at Cabela's, she'll tell you all about it. So that's Bridget's story. Now let's talk about systemic applications, because I know some of you are going to chomp on me about, what about all these autoimmune conditions? What about this? What about that? There are some systemic applications. Now I want to be clear here. When it comes to stem cell therapy, the FDA has raised its eyebrow at the ability to use stem cells directly as an IV. Therefore, back in April, we pulled back on doing that just because the FDA, we don't want that proverbial knock on the door from them. I hate it because it did so many people so much good, but what I'm about to share with you is groundbreaking as far as getting around that and still being able to get therapy. But systemic applications, what else can mesenchymal stem cells help with? Well, the answer to that is this. Someone calls me on a daily basis and asks me, what about condition XYZ? And sometimes I've never even heard of whatever that condition is. And I have to go and Google it to find out. But what I'll do is I'll do this. I'll go through and I'll talk about what stem cells actually do. Number one, they're anti-inflammatory. Number two, they modulate the immune system. And number three, they regenerate, regrow new tissue. Well, what we now know, and I'm getting ahead of myself. So I will go back and say, all right, you have condition XYZ. Here's the three things that they do. Does your condition have those three things? Okay. And this is George. And the answer, by the way, is usually yes. This is George. He walked into our office, and this is psoriasis. So this is his immune system attacking his skin, and you can physically see it on his knees. It was on his elbows, his shoulders, his butt. You're welcome. I have those pictures. I didn't show them to you. You're welcome. But this is the day of George's infusion. So we did an IV with George, and this is 14 weeks later. So there's a huge difference between those knees and those knees. And the reason for that is because of the mesenchymal stem cells, paracrine, remember that word? Paracrine actions, meaning their chemical influence on other cells. Their chemical influence is provided by what are called exosomes. What we know is that the stem cells themselves will release these exosomes, which are small structures within the cell released by stem cells as a reaction to injury. And these exosomes will go and stimulate that immune system reaction, that anti-inflammatory reaction. My voice is hammered tonight, guys. I'm sorry. They're released by the mesenchymal stem cell. They notify the joint's tissue that it's time to begin the healing process, and they actually have a systemic effect, which is pretty awesome. Exosomes play an important role on how stem cells exert their cellular function on other tissue. MSC-derived exosomes are responsible for many of the traits commonly associated with MSCs, including tissue healing, reduction of inflammation, and fibrosis, which is scar tissue. They actually decrease scar tissue. So the FDA says you can't, using cells is not something, they've raised their eyebrow at using the whole cells. But what we now have the ability to do is use the actual exosomes. We can, the labs can divide out the exosomes, and we can do those with you via IV and get the same effect as if we were doing stem cells themselves. And it's actually opened this huge thing for us that we're super excited about. And tonight is the actual first time that we're talking about it. So exosomes, when we're talking about doing IV therapies, then we're going to be talking about doing exosomes and their extracellular effects on other tissue, which to me, I feel like Kramer right now. It blows my mind. So that is what an exosome is. So when we talk about systemic effects, we'll be using exosomes. Okay. So let's answer to the basic question: does it hurt? Does getting stem cell therapy hurt? And the answer is, you're getting a needle. It doesn't always feel. Sorry, I'm checking my microphone again. Yeah. You're getting a needle. It doesn't always tickle. But I will tell you that our nurse practitioners do a fantastic job of making sure that everything is safe, everything is minimal, and doesn't hurt as well. There's a joke in our office, okay, that we say the nice people, number one, you got to show up. No, I'm not going to say that on the air. But the nice people will get the extra large needles. Now, we minimize it to make it hurt as little as possible. What happens most of the time is when the actual injection day, people work it up to be this big thing. And then when they walk out, they're like, oh, that was it? Yeah, it's a complicated procedure. You want to do it with the right hands. And we've got the right hands. But when you do it right, it's not a painful process at all. Okay? How long will it last? My dad, as I said, he's about 18 months out, still doing fantastically well. The how long will it last question, I can't answer for you directly, and I won't look you in the eye and give you an exact answer how long it lasts, because the reality is we just don't know. Hey, yeah, there's papers that indicate from this country 5 to 7 years. There's papers from other countries that indicate 10 to 15 years. We just don't know, and we don't know how you're going to react to it. There are different parameters that we'll talk about when we do this consultation that we've talked about. We'll talk about some things that help it last longer, things that you can do. But for most of our people, if they do stem cell therapy, we usually only see them once. We've had a few people come back. It hasn't been very often, but it's usually just once. So what should I expect? So expectations on the injection day are, as I said, people work it up to be a lot more than they think it's going to be. But after the procedure, most people's joints will hurt for a day or two, and then they'll stop hurting. And then 6 to 8 weeks after the injection, they'll really start to do. About 5 weeks into the injection, you're going to think I bamboozled you. And then about the 6th week, 6 to 8 weeks, they start to recover. And then the sweet spot's really 6 to 9 months down the road. So 6 to 9 months, that's usually when people will actually start referring their friends to this office, because they start seeing such a big result. In fact, I was looking at the metrics the other day from our clinic. Most of our people come from referrals, meaning their friends have done this and they've said, hey, you've got to check this out. And that's how most people actually find us, is through referrals. But again, expect to be in pain for the first couple days. And then 6 to 8 weeks out, that's when you'll really start to see a difference. And then the sweet spot, 6 to 9 months out. But it does take time. You got to understand it takes a while to regenerate that tissue. So be patient with that. And we will give you specific do's and don'ts about what to do before the injection, what to do after the injection. And when you schedule your consultation, we can talk about that as well. But that's what to expect. So is stem cell therapy and regenerative medicine right for you? Answer these three things for me. Number one, what's your overall health status? During the consultation, we will talk about what your expectations are. We're going to talk about what your medication list looks like, what are the diseases that you have going on, your height, your weight. Yes, I'm going to ask you how much you weigh, and an appropriate answer is not too much. I need to know a number because body mass does matter. We talk about all of those to make sure that we're set up for success here. I'm pretty proud of our success rate. The people that we've injected, over 90% of them have improved. A couple of them have not, and I feel bad about those, but it's just kind of the way it goes. That's the risk that you have to take, because the worst thing that will happen is nothing. It does happen, but not very often. And I think we filter some of those out. I'll give you an example. I had someone call me that was my age, that was over 400 pounds, and we turned them away just because with all the medications he was on, the stem cells would have just been a drop in the bucket for his inflammation. So those are the things we want to talk about. Second thing, mental mindset. Where's your head at with all of this? Because if you think this is a waste of time and money, guess what? It's going to be a big waste of time and money. But if you come into it with a mindset of hopeful optimism, saying, hey, this could be a really good thing for me. If it's not that big of a deal, but it could be a really good thing for me. And I want to proceed forward with this. That's the mental mindset we look for. The third thing is the financial part of it, because we don't want you to spend your last dollar doing this. We do have some financing options that are available, but here's the problem. If your last dollar is spent here and you're out of money, what does that do to your stress levels? It drives your stress levels up. When your stress levels drives up, guess what that does to our chances for success? Drives it down. We want to talk about that part of it when we do this consultation. But here's exactly what they cost, all right? PRP, so platelet-rich plasma starts at $750 per joint. Additional joints, additional injections of $300 after that. Keeping in mind, it may require more than 3 applications. Okay? If you want to start with PRP and see how that works out for you, you can do that. There's the cost that's involved. Stem cell therapy comes in cc increments. Okay, so if you do 1 cc, that's 1 joint. If you do 2, so that's $4,250. If you do 2 cc's or 2 joints, that's $6,750. And each additional joint after that adds $2,500. That's if you do them at once. Okay, now you can do one now, see how it goes, and do another one later. There's nothing wrong with that. It's just going to cost you a little bit more. The best thing to do is to do them all at once if you can. That's how much stem cell therapy costs. Exosomes, if we do exosomes alone by themselves, it's a 4 cc IV systemic application. So if we're just doing an IV for some of those systemic issues, then it's $4,850. If you do the same thing on top of a joint, then you add $2,750. And how that works is this. Hey, we'll talk about, your right knee is the big problem. And I will say, we're more than happy just to inject that right knee. Do you want to add on and do an IV on top of that to help with your general overall health and well-being? We can certainly do that. So that's the exact cost. We'll talk about exactly what you want to do. Our payment options are cash, check, or credit card. We have health savings account. You can use your flex spending account. We do have some financing options available. I need to take that OAC part off because we can actually, there's some stuff without credit that we can do as well. So these are your options. This is what we're looking at. The next step is to actually schedule that consultation. So on your screen, you have that big button that says schedule now. If you'll hit that button, that will actually take you to my calendar, and you can get on my calendar. We can get on the phone. We can do it here in the office so we can talk. And we want to talk about what is your number one goal. We're going to talk about, are we going to use IV, intramuscular, or injections? Where's it going to go? We're going to talk about your cost options, answer all your questions. Scheduling and timing is important. Right now, we're booked out until August 1st. So we want to make sure we get that scheduled down so what works best for you and your family. And last but not least, here's the offer that I promised you. This is the last time. For the last couple of weeks, the lab has been very good to us about giving us a discount that we've passed on to you. That discount's a 10% discount. So this is the people that come here on Wednesday, when I do this live workshop on Wednesday, they're not going to get this. That 10% discount is not going to be available to them. And the other thing we're going to do is if you do a stem cell injection, we're going to include PRP at no additional charge. So to me, that's a pretty big carrot. That to me is worth clicking on the button. Let's set up that consultation. So do that as soon as you can. Do it today, and then act quickly on this. Clearly, I have some mistakes I need to fix in here, but let's make sure we get that consultation done. Make sure it's a right fit for you, and then proceed forward. We'll get you that discount. So I want to say thank you. I'm going to end the slideshow here and pop back on to here. Looks like nobody had any questions for me. I appreciate you guys joining us tonight. It's been awesome. Thank you very much. And hit that button. Let's get scheduled for a consultation so we can sit down and talk. So looks like I went over my time a little bit. I apologize about that. But again, you guys have been awesome. I appreciate you. And we will see you very soon. Thank you.